My first pregnancy was what's called a molar pregnancy. So I lost the baby at 14 weeks.
What's the difference between a midwife and a doula?
Midwives and OBs are very similar, where they're both in charge of the physical safety. They're taking blood pressures, they're listening to heartbeats, they're offering medications and treatments, and even out of hospital births.
At what point would you transition someone from a home birth into the hospital?
So, the home births that I've attended, people have transferred for various reasons. Sometimes it's a medical reason, like if a midwife takes a blood pressure and blood
Mm.
pressure starts going up during labor, you're going to transfer before that gets dangerous.
Welcome to the Hope Natural Health Podcast. I'm Dr. Erin Ellis, your host. On this show, we discuss all things health, hormones, and happiness with a little side of this thing called life. Deep experience and a heartfelt perspective to the journey of birth. Suzzie Veers is a certified birth doula, childbirth educator, and the founder of She Births Bravely, a space dedicated to helping families feel informed, supported, and confident from pregnancy through the early postpartum period. Her own path into this work has been shaped by real personal transformation. After a difficult first pregnancy that ended in loss and a second birth that left her feeling overwhelmed and underprepared, Susie shifted her view of birth from something to fear into something she believes can be deeply empowering when women have knowledge, support, and advocacy. Since becoming a doula, she's supported over 200 births across settings from hospitals to homes and birth centers, and she's taught hundreds of parents through her courses and resources. She's also the author of Divine Birth, a book that blends insight and encouragement for expecting families. Today, Susie joins us to talk about how preparation, self advocacy, and compassionate support can change the way we experience birth. I'm super excited for this conversation, so let's welcome Susie.
Hello, thank you so much for having me. I cannot tell you how excited I am to get to talk about birth and babies and getting out of fear and having a great experience through it.
I love that. I would love to hear a little bit more about your background, your story, and really how you got into doing what you're doing. So, share.
Yeah, my professional career very much was inspired by my personal experiences. I say that I did the hardest first and then moved towards joy. My first pregnancy was what's called a molar pregnancy. So I lost the baby at 14 weeks. So it's still classified as a miscarriage, but a molar pregnancy is really complex where your placenta is kind of growing cancerously and you have to be watched pretty carefully after. That was very scary for me. I had never really been in a medical situation before, and it took me about a year before it was safe for me to get pregnant and try again. I then had my daughter Zoe. At this time, I was working in finance, and her birth was wild. In some senses, it was a lot easy. Like the pregnancy was so much easier than the molar pregnancy had been for those 14 weeks. But the birth itself, she was an emergency C-section. And I was like, the whole time, I was very worried about her status in it. As a mom that had gone through loss, it was a very real thing in my mind that what if we're this far and what if it doesn't like what if we don't make
Yeah.
it? And then we did have an emergency C-section at the end. I struggled a lot with postpartum depression. And then I met a friend who is a midwifery student, and we were in a new moms group together and we were hiking together like probably twice a week for about a year and a half with our littles. We'd put them in like little baby carriers and just go out in the mountains with this group of amazing women. And when I was just in our friendship over that year and a half, she shared so many stories about birth with me. And I realized I just had this feeling of I was so scared. I only saw this as a medical thing, and I didn't understand the emotional, spiritual side. And her being a midwife, she also was like the physical side as well, because it's also her job to keep people safe in labor. And so when she was sharing the stories about her family, I was like, whoa, I missed out on so much. And so then when I had my daughter, Hazel, 4 years later, she is 6, 7 now. Oh my God, time goes by so fast. I chose a lot of really unconventional options. I had moved again, but I found an amazing midwife. I ended up doing a home birth and a water birth. And I did have an OB consult and would have transferred if needed. But I just had the best experience in my birth. It was by far the most empowering and transformational experience. And the whole process of saying for the first time, I have this fear, and how do I let it stop controlling my decisions and my physiology, right? Because like stress gets written into your physiological responses in ways, was like some of the best work I ever did personally for myself in my own life. And then after that, I wanted to become a midwife as well, but I started as a doula and fell in love with being a doula and will be here forever.
Awesome. Let's start. This leads me to my next question. What's the difference between a midwife and a doula?
Yeah, yeah. So a lot of people think both of those terms, oh, hippie, natural, and you're not wrong, but it's also not necessarily right. Midwives and OBs are very similar, where they're both in charge of the physical safety. They're taking blood pressures, they're listening to heartbeats, they're offering medications and treatments, and even out of hospital births. Like when I had a midwife at my birth, like she carried medications like Pitocin and things like that. So she had oxygen for a baby. The baby needs to be resuscitated after birth. They are equipped and trained in how to do that. The big difference being that typically midwifery is focused on natural first. And a lot of times there's more space for that. So, like a typical OB appointment, 10, 15 minutes, pretty much what it's very quick.
Mhm.
Typical midwifery appointment, especially if you're doing a community birth, is going to be 45 minutes to an hour, sometimes 2 hours, because there's more of the recognition of we have to talk about your nutrition, we have to talk about keeping you healthy, we have to talk about, there's a lot of different scenarios you have to talk through and fear to process, and a lot of education that has to be done in that time. So they are longer. Doula, on the other hand, we're there for your like emotional and not the non-medical part of your physical care. So, like where a midwife might be taking your blood pressure, as a doula, I'm like, I've got the cool rag. I'm the one reminding you to drink your water. Often I'm the first one at a birth and then the last one to leave, because we're there for the early labor as well, and we're helping you do things like go for walks or set up your environment so that you can actually get a little bit of rest and remind you to use the tools around you. The natural ones and even epidurals. I know I've worked this year especially with a lot of high risk moms, and after epidurals there's a lot of things you can do as well to stay proactive with positioning and things like that, different massage techniques, acupressure, that really do reduce C-section rates and help. You can't prevent every problem in labor, but there's a lot that prevention can do to help birth stay on the right track, and that's what a doula does.
Okay. So like a midwife is very similar to the doctor, and I would say the doula is kind
Yes.
of either the nurse or maybe the coach.
Ooh, I wouldn't say
No?
nurse because they're still very medical
Oh,
focused, but coach is a good
okay.
word, patient
Okay.
advocate is a good word, and maybe a nurse assistant. Like
Okay.
sometimes, for example, like with epidurals, if it drop, like if the baby has like a heart rate dip, the first intervention to do that is often to move a mom into the hands and knees position, which like most usually takes like it is like a two-person job, right? So if you have a doula who's can help somebody who's numb from the waist down move, that's an option for you, where it's not if you just have one nurse in the room.
Got it. Okay.
Yeah.
So how would you recommend, like, or why should an expectant mom consider having a midwife, doula, and even a water birth? It's like I'm associating it to my field, right? So I'm a naturopathic doctor. I'm not
Yeah.
mainstream medicine. It's becoming more and more popular, but people are instilled in conventional medicine. It's, oh, I have this. I'm going to go to the doctor. I'm going to get this pill, right? Same thing with like childbirth. They go to the OB, they go to the hospital. Oh, water broke. I'm off to the emergency room, right? What, in your opinion, should an expectant mother even consider, like having the more natural doula, midwife,
Yeah.
water birth?
Yeah. My midwife was actually a naturopathic
Oh,
doctor
really?
too, and she literally changed my life. Yes, she stopped practicing midwifery because I think we all became her clients,
Who
and
is it?
she got so busy. Her name is Dr. Brandy Ross.
Okay.
Yeah, in Seattle.
Okay.
So she's fantastic. She specializes with children now that are on the spectrum.
Oh,
So she helped my daughter a
oh,
lot
nice.
too, my older daughter. Okay, so to answer your question though, sorry
It's
for
okay.
my tangent. Okay, so if you, there's nothing wrong with the obstetrical model of care. It is rushed. It does go for medical pill-based solutions first, right? You're not going to get a lot of support around nutrition. You're not
Mm,
going to get a lot of support around preventative things. That's okay for some people, and especially people who have complex medical situations should be in that environment. For people who are like, hey, I am healthy. I want to trust my body. I'm not planning on using an epidural. I want support around a natural birth. I want people who are very skilled at making a natural birth safe and like actually helping that happen. Midwives and doulas both show, like the studies on each of those individually, reduced C-section rates. For example, here in my state, midwifery care does about out of hospital midwifery care is about 4% of all the births here. When you look at the C-section rates for the people who are doing home births, and a lot of them have both midwife and doula. Some just have a midwife. You can opt out of a doula. You really need a midwife there, though. We offer a lot of value as a doula, but if you have to pick one or the other, I can't attend a birth without a medical professional. But if you look just at C-section rates for first-time moms that are doing community births in this area, their C-section rate is only 11%. And if you've had multiple kids, their C-section rate is less than 1%. Compare that to our hospitals. We don't have a hospital with a C-section rate under 30% in this area. So you are more likely to be successful. And if you do have a medical situation, you can transfer into the hospital. About 30% of first time moms will end up going to the hospital, usually for an epidural.
mm,
And then it's about 4% of moms that have multiples that transfer into the hospital. Water birth specifically, though, moms that are birthing in the water, it offers tremendous amount of pain relief. So it's the number one place for sanctuary in labor. It's a place to relax, release. It just takes so much tension out of the body. So there's a less need for epidurals, less need for opioid pain relief. Clinically, it does reduce the rate of hemorrhage, which is
mm.
interesting. I don't exactly know why. I have some theories, but I wouldn't call it hard science. I won't get into it. And then there's also a reduced risk of tearing. And then just in general, like the maternal satisfaction with birth typically goes up.
Mm. It is the C-section rate decreased with home births.
I think it's because when you're at a home birth, there is a tremendous amount of effort that goes into recognizing and taking care of every single one of a mother's needs in labor. And a lot of the needs that make labor kind of work is about how you feel because your emotions and the hormones that drive labor are so closely intertwined that when you're able to relax in labor, you do have more oxytocin, and oxytocin creates contractions. And I think to just give a quick example of how much your emotions can affect labor, I was at a home birth earlier last month, right before Christmas, and it's her third birth that I've worked with her on. And they obviously have little kids. She was pretty far into labor. She was doing so well. Her husband had to leave to bring the kids to the grandparents. And pretty much her labor, like almost disappeared. And she was like, the level of pain she was experiencing with contractions, she was like, oh my God, this is so hard all of a
Huh.
sudden. Like she was like it was just so much harder. You could see like she was like, you know, when you see someone in pain and their like
Yeah.
whole face is crinkly and their fingers like no matter, it wasn't a matter of just breathing through contractions, it was more painful. Anyways, he gets back. She looks at him. They hold hands. She's in the tub. She like relaxes her head down. He like does this little head neck massage thing for her. She relaxes. Her labor picks up like that. Right? So when you're at home, there's so much effort put into taking care of the environment, making it not stressful,
Mm,
making it like really peaceful and making sure you're fed and you're drinking and you're hydrated and you're at the hospital. There just isn't that, there cannot be that level of care because you don't have a doula and a midwife's assistant all focused on you. You have
mm,
a doctor who has 4 or 5 other patients who's going
mhm,
between rooms, and a nurse that also might have multiple other patients. And they're using technology like continuous monitoring instead of intermittent monitoring,
mhm,
which is very imperfect. And so they're continually interrupting you to get the technology to work right.
mhm.
And it's just very much of, it's good that we have the medical care. Like there are times where like C-section is the best option and being in the hospital is the best option. But those other things matter tremendously as well.
Yeah. At what point would you transition someone from a home birth into the hospital?
Yeah, that's a good question. So the home births that I've attended, people have transferred for various reasons. Sometimes it's a medical reason, like if a midwife takes a blood pressure and blood
Mm,
pressure starts going up during labor, you're going to transfer before that gets dangerous. Sometimes it's because a mom changes her
mm,
mind. If she realizes, hey, I thought a home birth was right for me, but now I'm here and I'm feeling a little stressed and overwhelmed and I
mhm,
don't feel as safe as I expected. Let's go. That's no big deal. You can change your mind at any point in time. And sometimes it is for pain relief,
mm,
right? Like we do see a reduction in the amount of medical pain relief when people use, obviously at home, an epidural is not an option, but there are people who, if you have a really long labor, or if you have, like one mom I worked with, she had been in a car accident several years before and had some chronic back issues, and in her labor that like kind of flared up in this unexpected way, and it was like, okay, all these like normal tools we're using for pain management are not working. Let's go get you the medical pain management. So there are various reasons like that where either for medical or just personal preferences change, it's okay to transfer, and it's good to
yeah.
when needed.
Yeah, for sure. At what
Yeah.
point would you not recommend someone have a midwife, doula, or even explore a water birth?
Yeah. Actually, I'm working with a mom right now who's going through that.
Mm,
She was working, usually it would be the midwife that would make the recommendation because it's part of their job to risk people out of their care
mm,
if they're not meeting clinical guidelines. If somebody has, the mom I'm working with right now, she has gestational diabetes
mm,
and it's not responding very well to treatment and diet and the things that they're trying to do to manage it. And so she has transferred to an obstetrical team because in general, big babies are not something to be afraid of, but with gestational diabetes, you can have huge babies. And so you need to be paying attention. And the babies can have their own like blood sugar issues when they're born. So they might need more likely to need the NICU or those like really higher technological
mhm.
interventions at birth, and other medical reasons like that, where it's just if you're going to need magnesium for your blood pressure, if you're going to
Blood pressure
need,
is a big one. I would,
yeah,
yeah, and blood.
yeah.
What about, say, a geriatric pregnancy or an older, like higher risk
Oh,
pregnancy?
yeah. So geriatric for moms over 35. That's
Which
a really
that
interesting
term
one.
needs to go away. It makes you
Be
sound like you're so old.
I know. Actually, there are a lot of studies that look specifically at this population and out of hospital births. So for moms over 35, actually there's a birthplace in England study that I believe looked at, I want to say 30,000 moms that were doing home birth versus hospital, and a significant portion of them were over 35.
Mhm,
And they found that the moms that were over 35 that did home births were at a very tiny elevated risk for things like a postpartum hemorrhage versus younger moms, but they were managed well and they had no extra risk for severe complications, losing a baby, having a NICU baby, or like their own being in a I'm trying to think about the right word to show like the scale of a problem. Oh, you had a little bit of a hemorrhage. It was treated and it was controlled versus it was uncontrolled.
Got it.
And you're now in a medical emergency. They didn't have that,
Hmm.
right? However, women over 35 in the hospital have a much higher rate of induction. They have much higher rates of complications and much higher rates of C-sections. So actually, that's one category of people where when you look at the numbers exactly, and I can send you the studies to put in your show notes
Yeah,
if
that would
you
be
want,
awesome.
but that in that category, it's flipped where it's actually much, much
Huh.
safer to start at home and then transfer into the
Okay.
higher care if needed.
Interesting. Who would have thunk?
Yeah,
What is the
I know it's weird.
this wasn't one of your prepared questions, but what is the training or
That's okay.
education to become a midwife or even, I guess, to a doula?
Yeah, yeah. So midwifery spans, there's many different paths to becoming a midwife. For most people, you're either a certified nurse midwife or a certified professional midwife, both of which have licensing and you pass a lot of tests, most of which you a nurse midwifery program is usually a master's degree, and a certified professional midwife is usually a 3-year degree. Plus, you're doing, I think it's 300 births with a preceptor. So you're doing a lot of assisting at births
Mm-hmm.
and learning from a mentor ahead of you. Doulas, we're not in charge of the medical things. Our jobs are like to make you walk in labor,
Yeah.
to do massage in labor, to, and I think we do become quite knowledgeable about the other things because we do, because we're there first. Like, it's really good to know, oh, this is not normal. We need to go in. There
Mhm.
are times that happens. And you're supporting people through these very complex
Yeah.
things and having to ask questions for them and advocate for them. But becoming a doula is more like it took me 6 months. It's like a
Mm.
certification. It's not, it's, yeah, which is why when we talk about if you're doing an out of hospital birth,
Mhm.
it's very helpful to have a doula there. Like, we are really good at helping you cope with that pain.
Yeah.
But we do not, I cannot replace a medical provider, and
Right.
I would not attend a birth without a medical provider.
So you have so to do home, you can have a midwife without a doula, but you shouldn't have a doula without a midwife. Got it.
Exactly. Yeah.
And what's the difference
Yeah.
between the two different midwives you mentioned? Are there different scopes that they could do? Like two different
Typically,
ones?
yeah, like a certified nurse midwife, they often actually work inside the hospital systems,
Okay.
and they often their style is very much more like obstetrical, where they have the shorter appointments. They don't have those 1 hour prenatals because they're more working. There is some crossover, like some nurse midwives will do home births, and some professional midwives can get privileges at hospitals so they can
Mhm.
transfer. But in general, if you're wanting to do home birth, you do the professional midwifery care, and if you're wanting to be a midwife in the hospital, you take the nurse midwifery route.
Got it.
It's like a strange, I don't know. It's strange that there's so many different paths to
Yeah.
caring for women in labor.
Okay.
Yeah.
Okay. Fair enough. What did we miss about what you do that would be helpful for the audience or any other helpful information? This is brand new to me. I don't have kids, so I've never given birth, but it's very fascinating.
Yeah. One thing that I hear from my mothers a lot is, what actually one woman said this verbatim to me this week was, this is the most important thing that I will do with my life
Mhm.
is creating this life
Mhm.
and bring how they come into the world matters. And I think that it's really important for women to think about, hey, like this experience in my birth, when I think about my first experience, it was very much how do I survive
Mhm.
this? And that was like, I had limited my thinking to only like my medical situation is the only thing that's important.
Yeah.
And that is very important. It should not be ignored. But that can also like just be the foundation. There's so much that comes through the birth process. It's a spiritual process, it's a bonding process with your
Mhm.
partner. It's a place where we grow in self efficacy and belief in ourselves.
Mhm.
And we are challenged, right? Like your nutritional needs change, the need for you to be watching out for yourself is going to, and taking care of yourself grows tremendously as well. That would be my last little words of
I love
encouragement
that.
is that you matter as
Yeah.
a mother and that your birth matters. And so to give it the proper attention and time it
So
deserves.
important. So important. Thank you for sharing that. I'll wrap it up with one last question I ask all my podcast guests. What would be your best or favorite health tip that you can share with the audience? It doesn't even have to do anything with childbirth.
say that have the courage to be proactive. I know for me, when I have found providers that I guess one thing that has changed significantly in my belief is that I used to believe that every provider was the same, that
Mm-hmm.
whoever I went to followed the same model and had the same
Mm-hmm.
beliefs and had the same tools. And I've realized that is not
Mm-hmm.
true. And so go find the person that's right for you. If that means you have to talk to 10 different doctors or go through 10 different styles of doctors or go through conventional and Eastern or different levels, someone out there has a solution
Mm-hmm.
for you. Don't give up
Yeah.
just because you're like not finding the solution in the first place.
I love that. That's so important. I preach that every day. Pretty much. Don't give up. Your symptoms are real. You deserve to feel your best. Don't take no for an answer. And it's great that especially women, like we're very loyal. And so you
Mhm.
find your OB and you're like, all right, I feel bad leaving this person, but it's really okay.
Yeah.
It's really okay if you're not getting
Yeah.
the care. You only have one life to live, right? So,
Mhm.
okay, I have plenty of patients that they've left my care because they wanted to get a second opinion or find something different. Or on the flip side, I get plenty of patients that have been to other naturopathic doctors and they haven't gotten the care that they wanted. So, it's okay to do exactly what you just said. It's so important. So thank you, Susie. This has been a great conversation. She does have a childbirth course where she walks women through how to cope with labor, the pros and cons of epidurals, pregnancy nutrition. She encourages moms to do one thing a day to take care of themselves through pregnancy. Take a walk, eat a healthy meal, watch a module of the class. There's fun bingo games, weekly prizes. So she's going to give us a discount code for that. We will put it in the show notes and also share all of her social media handles so you can follow along. But Susie, it's been wonderful having you here. I really appreciate your time.
Thank you so much. You have a wonderful day too.
Thanks. You too. We'll see you
Bye.
again next week, everyone.